Okay, so hello friends. Today continue the discussion on autonomic nervous system. Yesterday in the last video we have talked about dobutamine, we have talked about adrenaline, we have talked about dopamine, we have talked about their actions, we have talked the dose dependent actions of dopamine D1, B1, alpha 1 at 1 to 2, 2 to 10 greater than 10 microgram per kg per minute. Okay, so today I want to take, we have finished actually the last video, we have finished the catecholamines. Now I will be taking the non-cats. Okay, so non-catecholamines today. So let us take non-catecholamines. So non-catecholamines I will be taking. So non-catecholamines, I told you they don't have that catechol ring. Okay. Now, if you want me to, give you a simple concept about them, is that we have non-catecholamines which are acting on alpha 1. We have catecholamines which are selective alpha 1s, which are selective alpha 1s. Okay. And we have, some of them we are using for, for nasal decongestants. Okay. So we have alpha 1 agonists, we have alpha 2 agonists. Okay. And we have also beta 1 agonists, beta 2 agonists. So I can use them in these places. Okay. So I will first take alpha 1 agonist. Okay. So alpha 1 agonist. Alpha 1 agonist means they will go to the alpha 1 receptors and they will stimulate them and will cause that specific alpha 1 action. Okay. That specific alpha 1 action. Now we are using them as nasal decongestants. Nasal decongestants means when you are having more amount of nasal drips, you have nasal drips. Okay, nasal drips coming from your nose in case of any sort of inflammation happening, any flu. Okay, so what happens, your nose is getting what? Congested. It gets congested because of the vasodilated vessels. This is your nose and it gets vasodilated with these vessels, so they get so much bulky, and you have leaking of fluid. So to prevent that, what we give is we give alpha 1, because we know we have alpha 1 receptors on the blood vessel. We have alpha 1 receptors on the blood vessel. Now I give to this patient alpha 1 agonist. What will happen? They will have vasoconstriction and congestion relieved. Congestion relieved. You may have come across these names. There are so many brand names, but I am giving here these pharmacological names. We have nefazolin, we have silometazoline, and we have oxymetazoline. So we are using them as alpha 1 agonists. We are using them as nasal decongestants. We are using them as nasal decongestants, guys. Nasal decongestants. Fine. Okay. So one amount is alpha 1, they go and they will do this. Now, what is the problem with them? The problem is that once these drugs will do their effect, you are using them. Okay. It is seen that once you use them, once that effect is gone. For example, I took this spray. See, this is not a spray, this is an eye drop. But I took this spray and I did. Can we understand? So I did. Okay. So once I did this, I snuffed it. So I pumped it and you will get relief. But once its half-life finishes, Once its effect finishes, you will have after congestion again. So after congestion is seen with these drugs. So you have after congestion. You have after congestion. If you now you will be thinking, yes sir, I will be using it more and more, and I will be giving this patient for half full life so that he enjoys, he praises me as a doctor. Okay. So what will happen if you use it for long periods? For prolonged periods, it will cause a side effect that is called atrophic rhinitis. Atrophic rhinitis. It causes atrophic rhinitis. This is called rhinitis medicamentosa. Rhinitis medicamentosa. Medicamentosa. You will have that reflex. It won't work then. You will have atrophic rhinitis. If you use it for long periods, remember, you have given it for long periods. So atrophic rhinitis medicamentosa. Fine. Okay. Now see guys, this was about nose. If I go in the eye, the use of alpha 1, the eye. Okay. See, in the eye, we have a drug which we are using, that is phenylephrine. So phenylephrine is that drug which we are using as an alpha 1 agonist, as a mydriatic. What will alpha 1 receptors do? Mydriasis. Alpha 1 does mydriasis, isn't it? Alpha 1 does mydriasis. So it is that beautiful drug. I hope you know atropine. Do you know that when we were using atropine, it was a pupillodilator, it was a mydriatic. When I gave that, I was having also cycloplegia. But this drug, phenylephrine, will not cause cycloplegia. It won't cause cycloplegia. So it won't cause no cycloplegia seen. No cycloplegia seen. Fine. Now we also use these drugs as I can say, where else I can say, so many uses, but if I say alpha mediated action, I'm using it for the hypotension. Okay, vasopressor, I'm using it as a vasopressor. So use as a vasopressor, I will make a blood vessel. So blood vessel, so I'm using it as a vasopressor. Fine. I'm using it as a vasopressor, and this vasopressor action is that, see, in the hypotension, you are having a decrease in the diastolic BP. Okay, you are having a decrease in the diastolic blood pressure. Your DBP has fallen. Because of any sort of a vasoconstrictor action, vasodilatory action. Your vessels have gone into dilation. But what you want to do, you want to press these vessels so that the pressure increases, the diastolic BP increases. It's only possible when you do a vasoconstrictor action on the blood vessels. Okay, when you do a vasoconstriction action on these blood vessels. Okay, so what I will be doing is I will be using these as vasopressors. What are the vasopressors? I can use methoxamine, and mephentermine. These are alpha 1 agonists which are using for the hypotension, to treat hypotension. Please, hypo. Okay, hypotension. Hypo means I have a decreased blood pressure. So the purpose will be increasing the blood pressure. Okay, fine. Now a patient is coming to me and he says, with the change of posture, I have hypotension. The patient had change of posture. I had hypotension. So this hypotension, you will be treating this by these alpha 1 methoxamine and mephentermine. Okay. Now guys, there is a problem. The problem is that they have an adverse effect also. They have an adverse effect also. You tell me first, guys. You tell me, will I is will I give this drug in a patient of hypertension? Will I give this drug in patient of hypertension? It is contraindication. In hypertension, I already am having a vasoconstriction. Why I will give this? I will be worsening the condition. So it is contraindicated. It is contraindicated in severe hypertension. Contraindicated in severe hypertension and also narrow angle glaucoma. Narrow angle glaucoma, it will be contraindicated. Okay. Also, we are using it for what? Xylometazoline and this. I forgot to tell you what I have shown you in the beginning, that medicine. Okay. That was also present in it. So what was it? It was preventing the eye hyperemia. So it is used in the treatment of eye hyperemia also. Okay. So in the treatment of eye hyperemia. So eye hyperemia also we are using it. Okay. So the patient is now having what? I have another alpha 1. That patient, I came to know that he says I have orthostatic hypotension. So for the orthostatic hypotension, what I give? I give midodrine. Okay. Midodrine basically is a prodrug. I hope you know. I have taught you the prodrug. So in the prodrug, what is the active metabolite produced? Desclymidodrine. If you don't know anything about prodrugs, I have given a detailed lecture in the basics of pharmacology. That's why I told you to read the basics of pharmacology first. So it gives it is a prodrug, isn't it? It's a prodrug. So it will be converted to desglymidodrine. Desglymidodrine. Okay, so you use it for orthostatic hypotension. Okay. There was also another drug which was used long time back. It was phenylpropanolamine. The problem with this drug was it caused hemorrhagic stroke. So we don't give it. Hemorrhagic stroke. Okay. Fine. Okay. So let us do like this. Yeah. Now see, this was about alpha 1 action. Let me go to the alpha 2 action. Okay. Alpha 2 action, that is alpha 2 agonism, I will say first. Alpha 2 agonism. In the alpha 2 agonism, they can be used in number 1, uses hypertension. Number 2, diabetic diarrhea. Number 3, analgesic. Number 4, attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder. This will be reading in psychiatry. Okay. Person not able to focus, always having a attention deficit. Okay. And also hyperactive. Tourette syndrome. Person speaks abusive language like that. Gali de raha. Tourette syndrome. So withdrawal symptoms. Treatment is alpha 2 agonists. And we are also giving it migraine prophylaxis. migraine prophylaxis. Okay, we are also using it in muscle relaxant. We are using it as a muscle relaxant. Number 9, used for glaucoma. Used for glaucoma. Fine. Okay. And we are also using it, if I go to anesthesiology, we use it as pre-anesthetic medication, isn't it? We use it as sedation. Use it as a sedative. Now I want to make it easy for you how to remember. Okay, so how I remember is I put sparkle pen here. Okay, so this sparkle pen, you love this sparkle pen, I know. So for hypertension, which drug do you use? Which alpha 2 agonist do you use? We use methyl dopa. Methyl dopa. Okay, is it visible? Is this sparkle visible, guys? Yeah, so methyl dopa we are using. Diabetic diarrhea, again hypertension. So diabetic diarrhea, hypertension, and analgesic also, and ADHD also, and Tourette syndrome also, and withdrawal symptoms also. We are using what? Even migraine prophylaxis also. What we are using? We are using clonidine. We are using clonidine. Okay, we are using clonidine. Clear? We are using this clonidine. Okay, we are using methyl dopa for hair. Okay, methyl dopa for hypertension and diabetic diarrhea, attention deficit hyperactivity disorder, Tourette syndrome, withdrawal syndrome, migraine. We are using clonidine. We are using clonidine. Okay, here we have methyl dopa. Methyl dopa. Then what drug you are using? Alpha 2 agonism. Which drug is having the alpha 2 muscle relaxant action? It is tizanidine. Tizanidine. Okay. What about glaucoma? Yeah, we have very nice drugs. We have apraclonidine, brimonidine, apraclonidine, brimonidine, brimonidine. Okay, we have apraclonidine, we have brimonidine, we have tizanidine for muscle relaxant, we have clonidine for this action. Okay, clear? For sedation, we use dexmedetomidine, dexmedetomidine, dexmedetomidine we use as a pre-anesthetic. What we use at a pre-anesthetic medication? We use it as a pre-anesthetic medication. Okay, so it is a centrally acting alpha 2 agonist, centrally acting, isn't it? You want it to go into brain, so alpha 2 agonist. It is a centrally acting alpha 2 agonist. Okay, guys. We also had the drug for your withdrawal symptom, that was lofexidine. For lofexidine, basically we used to give it for, so we see a patient is on opioid therapy. Okay, a patient is on opioid therapy. I will explain it. Now what happens? He suddenly stops opioid. What will happen? He will get withdrawal symptoms. The symptoms which are happening on the withdrawal of a drug. So that withdrawal symptoms will be, to treat those withdrawal symptoms, you use lofexidine. To treat the withdrawal symptoms. Are we clear? Lofexidine to treat these symptoms. Okay. Okay, guys. Fine. So clonidine, withdrawal symptoms, lofexidine. Clonidine you are using for hypertension. Methyl dopa also can use for hypertension. Basically a safe drug in the. So let us. There was also something we know some alpha 2 agonist which we had for clonidinol. So we had guanfacine, we had guanabans. Okay, so you have to remember these important things about these alpha 2. Okay, so by the way, what can be the adverse effect of all these? They will cause what? Bradycardia. They will cause bradycardia. So adverse effects. So what will be the adverse effect of all these alpha 2 agonists? It will be bradycardia. What else can I think? Dry mouth. What else can I think? Constipation. Constipation. Sedation. And that we are using as a, and we also have what? Once we have seen, we have given methyl dopa. It causes autoimmune hemolytic anemia. Autoimmune hemolytic anemia. Okay, autoimmune hemolytic anemia. Fine. So this is what you have to remember. Now I go to the beta 1 agonists. Beta 1 agonists, tell me how many I have to say. Okay, so beta 1 agonists will be, you have to remember one beta 1 agonist first. That is, can you tell me any beta 1 adrenergic agonist? At least one. Do we know the dobutamine yesterday? Dobutamine. But what is dobutamine? Was it a catechol or a non-catechol? It was that we talked about them in the catechols, isn't it? So I have to say something which is non-catechol. So it is prenaltrol. Prenaltrol. So beta 1 non-catechol example. Non-catechol. Prenatrol. Prenalterol. Prenalterol. Okay. So it is used for what? To reverse the beta blocker action. To reverse the beta blocker. Okay. So to reverse this, we use it. Prenalterol. Okay. But catechols, you will be speaking that it should be dobutamine. Okay. By the way, where were we using dobutamine? Beta 1 is that also where were we using that? We were using a cardiac decompensation. Cardiac how to write decompensation? Cardiac decompensation. Okay. And what can be the adverse effects? Tachycardia, dyspnea, isn't it? And what are the contraindication of dobutamine? What are the contraindication of dobutamine, guys? Anyone? So dobutamine contraindication will be idiopathic hypertrophic subaortic stenosis, isn't it? Idiopathic hypertrophic subaortic stenosis. So this is the side effect you can remember. Sorry, the contraindication. And what else? Hypersensitivity reaction. Okay, if someone is hypersensitive to dobutamine, or sulfites. Fine. Clear? Next we go to beta 2 agonists. That means they will go to the beta 2 receptors. That means they will go to the beta 2 receptors. Once they go to beta 2 receptors, they will stimulate beta 2 receptors. So beta 2 action will be there. Okay. Beta 2 action, very vast action, I can say. Beta 2 adrenergic agonist. We use these for number one, I should say, asthma. COPD, and tocolytic. What is tocolytic? Uterine relaxation, uterus relaxation. Tocolytics. Tocolytics. Okay. Now you tell me, guys. See, in case of asthma, what is happening is I am having. In case of asthma, I am having what? I am having a If I talk about bronchial asthma, okay. If I talk about bronchial asthma, I am having a. I don't have a patent bronchus. I don't have a patent airway. It gets collapsed. The airway gets collapsed. Okay. Asthma. So what will happen? The patient has a difficulty in breathing. The air can't go into the lungs. Okay. So what will happen is I should do something so that I can bring the air inside. That means I should stimulate the beta 2. Once I do beta 2 agonism, I will be doing, if I stimulate beta 2, I will be having bronchodilation. Bronchodilation. On beta 2 stimulation, I will be having bronchodilation. If I stimulate beta 2, I will be having bronchodilation. Okay. So beta 2 agonists will be given. What are that? Salbutamol, terbutaline, albuterol, salmeterol, formoterol, metoprolol, levalbuterol, bitolterol, isn't it? Pirbuterol, salmeterol, formoterol, arformoterol, carmoterol, indecterol, isn't it? I used to learn them like that. Okay. So I will make you write some. I will write some beta 2 agonists for bronchial asthma. So we have salbutamol, the famous, you may have listened about this. Salbutamol is called albuterol. Then levalbuterol, metoprolol. No. Ipratropium, yes, you are right, but ipratropium works by anticholinergic action. Ipratropium, very nice, very nice. We can use that, but here we are talking about beta 2 agonism. That works by anticholinergic. That's where the doubt is, isn't it? Yeah. So that's why I told you to understand. So metoprolol, terbutaline, salmeterol, or formoterol. This I remember more, isn't it? Formoterol. I hope you know why I remember this more, isn't it? Formoterol. Okay. Cormoterol. There are so many. Indecterol. Okay. Formoterol, I forgot, right? Formoterol. So are using it as in the bronchial asthma, in the treatment of bronchial asthma. Fine. So what are by the way the side effects or the adverse effects? What are the adverse effects? Since they have a beta 2 action, so they will be having tremors. I hope you understand beta 2 tremors, isn't it? They will be having nervousness. Third, they will be having xerostomia. Fourth, they will be showing hypertension. Fifth, tachycardia. So these are the adverse effects of beta 2. Adverse effects of beta 2. Okay, agonists. Now talking about the tocolytics. Tocolytics will be tocolytic action of beta 2. Tocolytics, we use ritodrine and isoxsuprine. Ritrodine isoprene. You are using it as uterine tocolytics. Uterine tocolytics. Okay. Contraindication, hypersensitivity. Hypersensitivity. Okay. Contraindication, hypersensitivity. Fine. Now last one about this beta directly acting is beta 3. Beta 3 agonists. So beta 3 agonists. What are the beta 3 agonists? Yes, guys. Beta 3 agonists are mirabegron, isn't it? We have beta 3 receptors on the urinary bladder. Beta 3, beta 3, beta 3. And we know beta 3 does relaxation. I hope beta 1, beta 2, beta 3. Do we remember? Okay. So beta 3 receptors, they are the drug we use is if we stimulate beta 3, what will happen? They will cause dilatation, isn't it? So we give what? Mirabegron. Mirabegron is a beta 3 agonist. What it does, it will cause relaxation of bladder. That means it's used for the treatment of overactive bladder. It's used for the treatment of overactive bladder. Okay. So I hope I've understood. So we will be continuing this topic in the next discussion. Okay. So if you want me, I can revise for you for some time. So if you want to understand what are the uses of alpha-1 agonists, we are using them as nasal decongestants. We are using them as vasopressors. We are using them as mydriatics. What is the nasal decongestant? Anyone? Nasal decongestant? Zolines or Zolins. Zolins. All Zolins will be nasal decongestants like oxymetazoline, xylometazoline, nefazoline. These are, and they can also be used in the hyperemia. Eye hyperemia, redness of the eye. Okay. So for vasopressor action, we use midodrine, mephentermine, methoxamine, isn't it? For a mydriatic, we are using phenylephrine. Phenylephrine. That's why in this medicine there is phenylephrine. That's why it is phenylephrine, because I was having congestion. So I was having nefazoline. Why? Nefazoline was doing alpha-1 action. Okay. And phenylephrine was mydriatic. It was mydriatic. That's why when the doctor, the ophthalmologist, he gave me the drug, what he did? He first told me, asked the history, whether you have any glaucoma, whether he did my vision test, he did my every test, he took a nice history, so that he does not give a drug which is contraindicated. Okay, are we clear? So this is the concept. Third thing about apraclonidine and bromoclonidine is it is alpha-2 agonist. That is, we use it for glaucoma. So that means alpha-2. Where did I write that? Alpha-2. Where did I write that? Alpha-2 is, yeah, here I think, yeah. In the alpha-2 we wrote they are using as a, so if you want to use alpha-2 in glaucoma, we use it as a topical, isn't it? Topical therapy. Topical administration is topical. Okay. So this is what you have to remember. I hope you have enjoyed this discussion. Please subscribe to this channel for more videos. Tomorrow we'll be continuing this discussion. Okay. It will take us approximately some 4 or 5 lectures to finish this. But ANS is worth to understand like this, because otherwise you can't do any pharmacology. What point? Point 9. Glaucoma. Okay. Apraclonidine, bromoclonidine. We give it for glaucoma topical. Okay. They are selective alpha-2. They are selective alpha-2. Selective alpha-2. Okay. So take care. Bye bye. Have a nice day. See you tomorrow.